Hello everyone, welcome back to Dr. Dentico YouTube channel, and today's topic of discussion is tetracycline staining. So first of all, let's see what tetracycline is. So it is a type of antibiotic drug which is used to treat bacterial infections such as respiratory infection, infections associated with skin, eye, lymphatic system, intestinal system, genital and urinary systems. It was frequently used from the 1950s through the early 1980s. But nowadays it is not frequently used because of its adverse effect it can cause on our teeth. In young children, it can cause a grey or brown, deep dark stains that may affect the entire tooth or occur as a pattern of horizontal strips. So, in this image, you can see that grey color dark stains in the horizontal manner is present on entire teeth because of tetracycline. Now, when you administer this tetracycline systemically, in the pregnant woman at its time of development, it will bind with, it means tetracycline will bind with calcium ions and form a complex. This complex is formed on the surface of hydroxyapatite crystals within bone and dental tissues, and then it will lead to deposition of tetracycline within bone and dental hard tissues, and due to that discoloration can occur. Now, next is discoloration associated with tetracycline. It means how much discoloration can occur because of tetracycline. So, it is totally based on dosage and the period of time over which the medication was given. It means tetracycline was given. Clinically, when you see these teeth affected by tetracycline at time of eruption, these teeth are yellowish or brown grey appearance. Then it will be reduced with the time, and whenever this teeth exposed to light, it will change its color to brown, and anterior teeth are particularly susceptible to light induced color changes because they are more exposed in light. The various analogues of tetracycline produce different color changes. For example, chlortetracycline produce slate grey color and oxytetracycline produce creamy discoloration. So, in this image you can see slate grey color over here. So, this is because of chlortetracycline, and in this you can see creamy discoloration which is more yellow tint appearance because of oxytetracycline. In this image, we can see clinical appearance of discoloration due to tetracycline. So, you can see here horizontal grey color strips because of tetracycline. And this is image of tetracycline affected tooth in fluorescent photomicrograph, in which we can see deposition of tetracycline, right? Now, moving to next, a classification of discoloration caused by tetracycline. So, it is based on extent, degree and location of staining. So, according to that, we can classify this in 4 degrees. The first is first degree staining, in which the staining is minimal, uniformly distributed light yellow, light brown or light grey discoloration, which is restricted to incisal part of the crown. So, in this image you can see the slight yellowish discoloration can be seen, but it is in the incisal portion of crown. When we talk about prognosis of this first degree staining, it is good. It means with treatment we can cure this. Next is second degree staining, in which staining varies more in quantity and the location, it ranging from deep yellow to brown or grey with no bending. So, in this image you can see some amount of greyish discoloration is present but in different quantity and different sites. So what is the treatment prognosis for this? It is variable as it depends on entirely on the intensity of staining. It means how much staining is present, what site is covered, and after this we have to choose a treatment plan over this. Now moving to next, which is our third degree staining, in which we can see dark brown, dark grey, purple or blue staining with marked bending. So in this image you can see the bending of greyish discoloration can be seen in this degree staining. Now if we talk about the prognosis for this, it is an efficient and aesthetic outcome is not good, although teeth may be lightened to some degree. In this we can go for bleaching, and after this bleaching we can lighten this discoloration. Next is fourth degree staining. In this intense pigmentation combining very dark stains with highly pronounced bends. So in this image you can see it is totally damaged teeth surface because of tetracycline staining, and all the teeth are looking as a greyish black dark stains. So for treatment plan we have to go for full veneers or full permanent restoration. Next is how to prevent the staining. It means what is the time to avoid this tetracycline. In a short line I can see we have to avoid this from 29 weeks in utero to the 12 years of age of child. If you don't want any kind of tetracycline staining in your temporary or permanent dentition. So this tetracycline is able to cross placental barrier, so it should be avoided from 29 weeks in utero until the full term to prevent incorporation into the dental tissue. Now if we are talking about permanent teeth, which is continue to develop in the infant and young child until 12 years of age, so this tetracycline administration should be avoided in children below this age and in breastfeeding and expectant mothers. We have to avoid this tetracycline till the age of 12. Then if we are talking about particularly incisors and canines, in deciduous incisors and canine, we have to avoid this from 4 months in utero to 5 months of postpartum, and in permanent dentition for incisor and canine teeth, this period is from 4 months of postpartum to approximately 7 years of age. So as I told you, we have to avoid this from 29 weeks in utero. It means approx 4 months in utero to the 12 years of age to completely prevent any kind of tetracycline staining. Next is treatment options for this tetracycline staining. In past, it was believed that these tetracycline stains are permanent and there are no treatment options available to cure these stains. However, several studies reported some successful treatment options like walking bleach technique, power bleaching and veneers. So starting with walking bleach. So what is a walking bleach? Why it is called walking bleach? Because when we put walking bleach agent inside the tooth, it means any kind of bleaching agent we put inside the tooth, and after this patient can walk out from clinic, and that's why it is called as walking bleach. In this we are using normally a bleaching agent called sodium perborate. Sodium perborate, and this sodium perborate should be mixed with either hydrogen peroxide or the normal saline and making a paste, and then we put this paste inside a tooth. How this walking bleach technique is performed? So first of all, this is your stained tooth which you want to treat through the walking bleach. In this you have to first treat this tooth with the RCT. That's why this walking bleach is a type of a non-vital bleaching. So you have performed your RCT normally, and after this you have to remove 1 to 2 millimeters of your gutta percha from this root canal. So you have removed your gutta percha of 1 to 2 millimeter. It is approx till the cemento enamel junction. You have removed your gutta percha and then you have to place a barrier to prevent your bleaching agent to go inside the root canal. So this barrier is made up of resin modified glass ionomer cement, and the thickness of this barrier should be around 2 mm because we have removed 1 to 2 mm of gutta percha. And to prevent this bleaching agent, we have to make this around 2 millimeter. After this, we have to put our bleaching agent, and then we have to fill this tooth with the temporary restoration. The thickness of this cavity should be around 3 to 4 mm. So we can say approx 3.5 mm thickness should be there for cavity. After 1 week, you have to call your patient, and if a desired result is achieved, then you have to remove this temporary restoration and bleaching agent and seal this tooth with your permanent restoration. If it is your anterior teeth, you have to go for composite restoration. Moving to next, which is power bleaching, and it is a type of vital bleaching. Why it is vital bleaching? Because in which we are not doing any kind of pulp therapy before bleaching, and bleaching agent which we are using for power bleaching is 30 to 35% of hydrogen peroxide gel. For bleaching, we should not use local anesthesia because we want patient's response in this, because we are using 30 to 35% of hydrogen peroxide which can cause soft tissue burns. If we give LA to patient, then how will patient tell to you, yes, I have some burns over this side of on soft tissue. So we should not use local anesthesia in this procedure. So we start this procedure by cleaning this teeth, and then we have to apply a gingival barrier to prevent any kind of soft tissue burns, and some part of gingival dam should be overlap on the tooth at the portion of cervically, it means over here. Remember that no interdental papilla should be skipped in this procedure because it can cause soft tissue burns. So after applying this gingival dam, we have to cure this gingival dam with the light cure. Then take out your hydrogen peroxide gel. After this, we have to apply this over a teeth, and then for 15 minutes it should be present on a teeth. After 15 minutes, you have to suction this out. Don't rinse water because it can splintering the gel in the mouth and it can cause soft tissue burns. After your completion of procedure, you have to remove this gingival dam. Maximum 3 times you can do this procedure in a single sitting, not more than this. After removing this gingival dam, you have to rinse this teeth with water, and you should apply a vitamin E over your gingiva to promote healing. If any kind of soft tissue burn is there, then we have to apply this vitamin E. So this is about a power bleaching. The last option of treatment is a veneers. This is image of veneers. So you can see the tetracycline staining over here, all the teeth, and after this we have to choose a proper veneer. So this is all about tetracycline staining and its treatment option. Hope so you like this video and this video is helpful for you. If you have any doubt, let me know in comment section. Thank you so much for patiently listening.